Tēnā koutou, tēnā koutou, tēnā koutou katoa. I te taha tōku pāpā, no ingarangi, no himene, no porona o kutupuna. I te taha tōku māma, ko tūtamoe te maunga, ko kaihu te awa, ko taita te marae, ko māhuhi ki te rangi te waka, ko ngā te turihina te hapu, ko ngā te whātua o kaipara te iwi. Ko tūranga mahi ki mahutonga hoipi pira o Rotorua, he mātanga tapui. Ko Irene Walden tuku ingoa. Kia ora, I'm Irene. I am a nurse practitioner in Southern Cross Hospital in Rotorua.
Kia ora, tēnā koutou, tēnā tātou katoa, me mihi ka tika ki te waitaha, ki earaki te maunga, ki waitaki te awa, ki kaitahu te iwi, kei o te tahi ahau i noho ana, I whana mai ki te ingarani, ko Pippin tōku ingoa. Kia ora, I'm Pippin, I'm a nurse advisor at Southern Cross Healthcare, and I'm based at National Office. Today we're going to talk about the work we're doing with the New Zealand Sepsis Trust about enhancing the expertise and the knowledge out there with our healthcare professionals so we can recognise sepsis early. The reason Irene and I wanted to talk to you about sepsis is because we know the impact that this can have on patients in whānau. We know in New Zealand 53,000 patients a year are affected by sepsis, and so it's really important that we recognise early, we use the tools from the Sepsis Trust and we intervene early.
Early recognition means that we can organise a timely, coordinated, multidisciplinary response to action the appropriate care to mitigate risk.
So sepsis can happen to anyone, but the risk factors are if you're old, if you're young, if you're pregnant, if you're immunocompromised, if you've got any chronic medical diseases, and surgical and trauma patients can be affected. Māori, Pacifica and ethnic minorities can be affected by sepsis, and also those who have previously had an episode of sepsis.
Kiritaki can have normal vital signs and still have sepsis. There is no one symptom, sign or test to identify sepsis. If you suspect someone has sepsis, trust your gut and use the screening tools.
Yeah, absolutely, and listen to your patient whānau and their whānau. They're often the people who will detect the deterioration before the nurses do, so really important that we value what they're telling us about their loved ones.
Sepsis moves fast, so it needs to be recognised early and effective interventions applied to improve kiritaki outcomes. Sepsis can kill in less than 12 hours. It is crucial that sepsis is recognised and treated early. For every hour that treatment is delayed, a kiritaki survival rate reduces by 8%. To maintain patient safety, we have collaborated with the Sepsis Trust New Zealand, who use the Sepsis Six principles. We use the Trust screening tools and action tools, as well as our early warning guidelines to recognise patient risk and recommend treatment. The screening tool is designed to flag the potential sepsis. Red flag equals high risk. Amber flags indicate a worsening in systemic infection and pre-sepsis stage. If you have 2 amber flags, this is a moderate to high risk. Always treat these flags as sepsis. Escalate early. It is far easier to de-escalate treatment than it is to re-escalate life. Remember that an EWS of 0 does not always exclude deterioration. If you've utilised the screening tool and it has flagged a risk of sepsis, you then move on to completing the Sepsis 6 actions, and these must be completed within 1 hour. These are 1. Administer oxygen. 2. Take blood cultures. 3. Give IV antibiotics. Refer to your local hospital antimicrobial guidelines and consider allergies prior to the administration. 4. Give IV fluids. 5. Check serial lactates. 6. Get senior help immediately, as they have the ability to arrange urgent investigations and referrals. Refer to the Sepsis Screening and Action tool for full details. Complete the Sepsis 6 screening tool within the first hour. Increases survival by 47%. I want to share with you a case that happened recently that actually shows the speed at which sepsis can actually happen. We had a gentleman that came in and had his bilateral hips done, and he was doing great. Day one, he was doing all the things that we like patients to do, to tick those boxes. You know, he's eating, drinking, mobilising, his pain management was great. But on day two, suddenly he started shivering, and our HCA recognised that this wasn't right, so she escalated it, which was cool. And the nurse recognised straight away that the shivering was actually Riger's, so she jumped on to grabbing the sepsis screening tool, and he was already triggering off of our early warning score, so she activated the Sepsis Six, and this went down really quite rapidly. But the key thing is telling you how fast this happened. So initially his respiration rate was already at 23 and his oxygen was already at 90%, and he had a heart rate at 112. But his rest rate was climbing, his heart rate was climbing, and it wasn't until 18 minutes after the onset of him having those Rigers that he actually spiked a temperature. But by this time his heart rate was at 154, his respiration rate was in the 30s, his oxygen was dropping again despite already being on oxygen therapy. So it just shows the importance of that early recognition, and because Sepsis 6 was already activated, the actions as part of that tool were already complete within the first hour. From that, we ended up having a multidisciplinary response, which was great. So the surgeon was on the phone with the surgeon up at Public. The anaesthetist was liaising with the ICU consultant, and our coordinator on the ward, she did an amazing job at reallocating staffing roles to ensure that the nurses that needed to be in that room to provide that one-on-one care was recognised. And he was transferred out 3 hours after the initial onset, and this recognition meant that his outcomes were really significantly improved. He actually only ended up spending 5 days within the intensive care unit on minimal support. Because of this recognition, because of immediate interventions, which were what were needed, he didn't actually end up requiring any further surgeries, and his new metalware actually ended up being protected. Be a sepsis hero. If you suspect it, say it, stop it.